Interprofessional communication involves the direct or indirect transmission of patient information between multidisciplinary teams to ensure the best health outcome is achieved. There is sufficient evidence that highlights poor communication between healthcare professionals regarding the patient's presentation, history, and goals has detrimental short and long-term effects. Whether in the form of a clinical handover, documentation, or other means, the role of the paramedic is to use communication skills to advocate for the best possible clinical avenue for their patient. The ability of the paramedic to communicate to other healthcare professionals in often high-stress and complex situations is paramount to the ease of care and hence a more successful patient journey through the healthcare system. This essay will highlight the importance of clear and succinct clinical handovers at triage and other locations, as well as discuss the need for judicial and truthful documentation. I will also incorporate my own experiences as a student to reflect on the importance of interprofessional communication and its relevance to my future. Handover is the process of transferring patient information, responsibility, and accountability from one clinical professional to another for continuation of care. Improving clinical handovers is considered a goal of patient safety and one of the top 5 World Health Organization priorities. Emergency departments are often overcrowded, noisy, and distracting environments. Adjacent to critical patients and time constraints, it is not uncommon for data to be lost and information to be misconstrued. Safe, effective, and patient-driven care once in the hospital system is ultimately spearheaded by the accuracy of the paramedic's handover to ensure the patient is referred to the correct services. These services may include cardiac teams, mental health workers, ENTs, and the list goes on. Information transfer between paramedics and emergency department nurses or trauma teams are hindered by interruptions, overcrowding, multitasking, relationships, and heavy workloads. A lack of active listening by the receiving party, whether an ED nurse, trauma team, or other health professional, has been shown to deplete the reliability of the clinical handover by simply missing vital information, requiring the paramedic to repeat themselves. A possible solution to this has been researched by Jensen, Lippert, and Ostergaard. It involves providing the clinical handover in 2 parts. Part 1 involves only handing over the information essential to the patient's initial complaint. Part 2 is handing over the rest of the information once baseline observations and examinations have been completed. However, constraints limit the paramedic to minimal time in hospital. Other problems often identified with handover practice include unstructured handovers, thus leading to inconsistent and confusing information, excessively detailed information that detracts from the main problem at hand, illegible handwriting, thus causing either party to lose their spot and become confused, the transfer of inaccurate information, such as patient allergies, medications, and vital signs, communication barriers, such as language or jargon, alluding to the possibility for Chinese whispers, difficulties in creating a shared cognitive picture, for example, the scene of a car accident or the living conditions of a patient, and finally, interruptions by either other paramedics, late clinical staff, questions by the receiving team for the paramedic, or the general background noise and distractions of a busy emergency department. Such problems can lead to complications in patient care, such as unnecessary treatments, misdiagnoses, medication errors, patient injury, and potentially death. To combat potential complications, there are methods to ensuring an effective and succinct handover. Following mnemonics or guides when performing clinical handovers can ensure that vital information regarding the patient does not get lost or miscommunicated. I missed AMBO is a mnemonic that covers most of the important components of a patient's presentation without allowing confusing or unnecessary information via distraction. It allows the receiving staff to gain a quick and reliable understanding of the patient's presentation while enabling them to prioritize their treatment accordingly. Literature suggests that the use of I missed AMBO enables a greater volume of reliable information be collected and more consistently ordered. This reduces the need for interruptions and follow-up questions from the ED staff. It decreases the length of the handover, and it requires fewer repetitions by both ED staff and paramedics, alluding to improved comprehension and retention regarding the patient's history and complaint. Handovers to emergency departments are not the only relevant handovers paramedics undertake. With high acuity patients, both trauma and medical in nature, Advanced care paramedics often require the backup of more qualified clinicians with a broader scope of practice to aid in the management of complex clinical situations. When first on scene, it is a responsibility of the primary officer to collate as much information as necessary so that when more qualified clinicians arrive, there is no delay or hesitation in beginning the most appropriate treatment for the critical patient. A similar handover process is implemented here, where the primary officer gives the critical care paramedic or the HARU clinicians a succinct and informative story regarding the patient's current presentation, medical history, and other relevant details. Another form of interprofessional communication is written and electronic documentation. Clinical documentation is a collated report of a patient's presenting complaint, treatment, and history, and is shared with all practitioners involved in their care. Paramedics complete electronic documentation of each patient interaction, whether they were transported to hospital, left in the care of another facility, or refused service. It is vital that these documents are honest, accurate, and objective so that the receiving facility can comprehend and administer the appropriate treatments for each specific patient. This process gives the paramedic an opportunity to document a more in-depth analysis of the patient for the hospital's benefit, with information that may not necessarily be relevant in the clinical handover. This can include the patient's social situation, minor complaints, and other observations. Incomplete, inaccurate, or dishonest documentation has been shown to have detrimental effects on the patient, for example, allergy mistakes, social complications, and medical history errors. The documentation paramedics provide will not solely be referred to during one specific hospital stay. However, it will be able to refer to for future hospital admissions, interpretation of clinical findings, and legal and educational purposes. The documentation provided can protect paramedics and other treating clinicians against malpractice suits when recorded truthfully and appropriately. Furthermore, as a student, using previous mentors' documentation as a base for developing my own techniques has been a great aid in learning the proper way to document all patient interactions. On the other hand, reading poorly structured or disjointed paperwork has also been beneficial in learning what not to do when I begin my career as a novice practitioner. Throughout my placements, delivering a well-structured and succinct clinical handover at triage and bedside has been an area of difficulty I have endeavoured to improve upon. Initially, my handovers were disjointed and confusing, often requiring my mentor to intervene and take over. I often forgot small pieces of information, specifically things that I did not understand the relevance of. However, after accepting advice and critique from my mentors and undertaking further research of my own, I have learnt the importance of highlighting the most critical points regarding my patients and discovered the line between what is relevant and what is not. I found that each mentor I have worked under adopts small modifications to their handover techniques to ensure they never forget vital information and the patient is referred to the correct services without fail. I have also focused on improving my handover to critical care paramedics and other crews that attend high acuity patients in the community as our backup. I initially struggled with this. However, I am becoming more confident and able to work in these multidisciplinary teams. I found that writing information down is a good way for me to ensure I deliver all of the necessary information to the more qualified paramedics so that the appropriate treatment of the patient can begin as soon as possible. I believe tutor-driven simulation practice and self-directed learning sessions gave me the opportunity to fine-tune my handover skills. However, I believe students need more experience in the documentation area of clinical care. The only experience students get to practice documentation and paperwork is during clinical placements. I believe I would have benefited from practicing paperwork such as roll forms and EEAs during university simulations in order to be better prepared for my time on road. When I begin my career as a novice practitioner, I will continually develop my handover skills by observing and practicing techniques I learn from other professionals and endeavour to be a reliable and trustworthy source of information regarding every one of my patients. The aim of a clinical handover is to provide correct and succinct information regarding the patient and their health status to emergency departments and other multidisciplinary teams. This enables continuity of care and reduces the likelihood of patient adverse This enables continuity of care and reduces the likelihood of adverse patient effects. Clinical documentation must be honest, objective, and relevant to the patient's presenting complaint while highlighting social situations or other information that can influence their care but might not be relevant in the initial clinical handover. The role of the paramedic is to advocate for their patient and ensure that their handover triggers the hospital to refer the patient to the correct services. Techniques such as mnemonics are a great help in this. However, as paramedics, we must be hypervigilant regarding the possible barriers leading to communication errors, thus decreasing the likelihood of adverse clinical effects. Thank you.